Hi, I am Esha R Shanbhag. I am a gynae oncologist at Aster International Institute of Oncology, Whitefield, Bangalore. So, May 8th is celebrated as the World Ovarian Cancer Day. The theme is No Women Left Behind. So, this day marks us so that we educate ourselves about this lethal malignancy, the ovarian cancer, which we also call the silent killer. The reason we call it a silent killer is because usually women don't present to us at early stage. Nearly 75% of the women, when they come to us, are in an advanced stage and thus a poorer prognosis. At the same time, unlike other cancers like breast cancer, cervical cancer, colorectal cancer, where we have a screening test to detect, we don't have it in an ovarian cancer. Thus, it highlights to us that we need to be aware of what places us at a higher risk, what are the risk factors, what are the symptoms, and how we can improve the survival, what are the various treatment options. Nearly 1/4 of the people who have ovarian cancers usually have a hereditary tendency. So if any woman has a family history of ovarian cancer, breast cancer, or any related cancer, they need to speak to a doctor so that we see if a genetic counseling or the testing is required. At the same time, ovarian cancer is usually found in women elderly, that is beyond 50 years, or those who have not had children at all, or have endometriosis, or have taken multiple hormonal treatment, places them at a higher risk. So what are the various symptoms? These symptoms are not specific, they are very vague. Like you have persistent bloating sensation, you have tummy pain which keeps coming and going, you have urinary symptoms, you don't feel like eating at all, you feel full very quick, or you're losing weight. So these are symptoms which are not very specific to ovarian cancer. So these are very vague, and as a result of it, we don't pick up ovarian cancer early. But the key here is the persistence. So if you have a persistent symptom, please make it a point to see a doctor whom we have a very high index of suspicion to identify if there's any ovarian cancer. So we might examine you, we'll order a few simple tests like ultrasound or blood tests for the tumor markers, and we'll be able to pick up if you have cancer or not. So even if you do get cancer, please don't worry. There are a lot of treatment options for us. Recent advances where the surgery plays a role, and we have a lot of advanced technologies at our hospital, where German technology, Italian technology, where we spray chemotherapy inside when we examine the disease. At the same time, we try to debulk the entire burden of the disease and give heated chemotherapy, which we call the HIPEC. So with all of these treatment options, we are definitely able to improve the survival, we are able to cure you of the disease. So if there's any further queries pertaining to ovarian cancer, feel free to come here, visit us, have a discussion with us at Aster Whitefield Hospital. Thank you.